I'm from Cincinnati, Ohio. And this is
This is Sam Allred. I'm from Mesa, Arizona. And this is
My name is Garrett Neild, and I'm coming at you right now from Medford, Oregon.
okay, and we're going to be starting our project on dengue fever. So let me give you some background. First of all, we chose to study dengue virus in our international health project because of the epidemiological and economic burden that endemic countries are facing. Dengue is widespread throughout the tropics with risk factors influenced by variations of rainfall, temperature, relative humidity, degree of urbanization, and the quality of vector control services in urban areas. Today, the disease is endemic in more than 100 countries in WHO's African Americas, Eastern Mediterranean, Southeast Asia, and Western Pacific regions. Now, the Americas, Southeast Asia, and Western Pacific regions are the most seriously affected. Dengue fever is a health-related problem in New Delhi, India. It is a viral infection. It's transmitted by a bite of an infected Aedes aegypti mosquito, and the infections produce mild or no symptoms and can resolve on their own, but may require hospitalization for supportive care to alter the progression of the illness. Now, the dengue infection can be caused by any one of the 4 dengue viruses, serotypes 1 to 4. Infection by one serotype produces lifelong immunity against that serotype, but one is susceptible to be infected by any of the other 3 serotypes. Although there's the risk of getting the severe dengue after infection, the second infection is usually by another serotype that was not previously infected with. So the dengue virus can cause severe dengue, and it can be life-threatening. One single infection can cost a lot of money, actually a burden on the health sector and the economy. So a vaccine called Dengvaxia was recommended by WHO, which prevents this burden and significantly causes economic gains. Now we'll be using a combined approach called integral vector management, which is IVM. This is endorsed by the United Nations Environmental Program and WHO, as well as by other partners and countries. Now, IVM improves efficiency, lowers costs, provides environmental security, and sustained disease vector control instead of relying on one single method. It stresses the importance of first understanding the local vector ecosystem and regional patterns of disease transmission, and then choose suitable vector control method. So the IVM supports more accessible and affordable rapid diagnostic tests before the administration of the dengue vaccine, along with adequate disease diagnosis, treatment, monitoring of disease incidence to fine-tune and improve vector control strategies. Community support and increased individual awareness are necessary to facilitate a more integral approach to vector control, prevention, disease care, and treatment measures to ensure sustainability. Now, there have to be responsibilities allocated to various areas to function for optimal level of the overall system. And we have to look at the national government and the provincial or the district coming in play with the community at community levels as well. We will need to work with the Ministry of Health, Agriculture, Water Resources, and Land Authorities, because regulation is critical to ensure that other sectors comply with standards and norms that reduce the environmental conditions in which vectors thrive. Sanctions and incentives are means of enforcement, just as having adequate inspection mechanism for such capacity will need to be strengthened. There is no need to examine the local setting of the disease vector, identify disease transmission patterns, and then carefully design intermittent update policies and action plans. So we will now look at the various ways that we can employ our vector control to make it sustainable and to make it effective. And Sam will be looking at that.
Okay, so I'm going to just basically go over just the different types of methods for vector control and implementing all this. And there's several different ways we can do that. But before we get into that, we first need to monitor the different mosquitoes that are in the area. So with the help of entomologists identifying the native species, we can find out which ones are there and also find out of those species the common vectors of the dengue virus. So that's kind of the first step. We also need to identify the areas that are prone for mosquitoes. And so we need to determine, and some of this is known facts, some of this is by investigation, but we also need to determine the known major breeding sources of the mosquitoes. We also need to determine the high-risk areas through mapping of the communities. So this is basically done by looking at the map of the area and finding in those areas where it's a high risk that a breeding source would be located. And so that's part of identifying the areas that were prone to mosquitoes. So after those two steps, we would then proceed to go to source reduction. We want to remove any potential breeding sites for mosquitoes. These can be things such as tires, non-biodegradable plastic containers, any source of water tanks, or anything basically that has stagnant water, and to remove those or to cover those so that there is no places for the mosquitoes to breed. Outside of that, we also want to look at preventative larviciding, which basically is destroying the larvae. And this is done by a few ways. Ones that we want to focus on is the use of microbial larvicides. There's one that's very effective, and I'm going to butcher the name, but it's Bacillus thuringiensis israelensis. It's very effective, but what's great is it's also it's safe for humans. So that is a process or a tactic that we'd like to use. And also there are some fish that are larvivorous fish, which basically means they feed on the larvae. And that's another tactic for preventative larviciding. We also want to look into also spraying or insecticides. Obviously, we need to be ecologically minded in this, and it may increase as breakouts increase. So at that point, we'd want concentrated efforts, team effort, and organizing the sprayings within the different areas. And then lastly, we want to kind of focus on the personal protection. So things that people can do within their own communities for themselves and their own families. Those are things such as mosquito nets, insect repellents, the way they clothe themselves, making sure they're covering a lot of their body. There's things such as mosquito coils and just general hygiene and house cleaning and making sure that we don't allow mosquitoes to have the opportunity to have breeding sites. And so those are the things that we can do as far as vector control. But obviously there's more that we can do in regards to policy and government and things to reach out that way. And Garrett's going to kind of talk about a little bit about that.
Hi there. I am going to talk about the legislation and the public awareness as it relates to dengue in India. So there's some questions we can answer about the legislation currently in place in India. So first question is there legislation? The second one is, can we enforce that legislation? And there is legislation. There's things set up in India to help control and prevent dengue. Something called the NVBDCP, or the National Vector-Borne Disease Control Program. And this is the central agency that is supposed to prevent and control dengue fever, in addition to other things like malaria and other serious illnesses. One of the main issues that could be changed is that this is a national program. The National Vector-Borne Disease Control Program is national. However, in the individual states in India, it's not something that is mandated. So there should be a mandate that in the states in India that that they implement this program. That's a big pitfall that can make it very difficult for these things that we're talking about to get put into place across India, and not just in the main areas or more populated areas. So can we enforce the legislation? We can, if it's mandatory in all states, but the government has this support system set up, but there's also issues at a clinical level where when people are passing away from dengue fever, to control the panic in the communities or in the public. In some cases, they have said that people have died from different things other than dengue fever, when in fact it was dengue fever. That's a serious issue because it's not showing the complete scope of the problem, and so better coverage in that area is needed so that we know exactly how many people are being infected and dying from it. Probably one of the greatest issues with enforcing legislation is the economic factor. There's just not enough money and resources for example, labs that can accurately diagnose and report these cases. Those are some. That's just an example of one of the challenges that increased funding could help. And for example, in better teaching for those at a clinical level to understand what the signs of dengue fever are. Lastly, I want to talk about public awareness. India, as far as my research found, is that they're actually doing a pretty decent job of getting the information out there in some forms. For example, there's a National Dengue Day, which happens to be on May 16th of every year. And that is a great time for people to find out more about dengue. It's a good way that the government has set up to increase awareness. They have a mobile app that is available to people where they can learn from that, especially with this new and upcoming generation where everybody is more plugged in. One of the effective ways is just to teach children at a young age. And I guess one of our points would be to teach them from very young about dengue fever and ways to avoid it and what they need to do to be safe. Because the records show that there's large amounts of children dropping out of school before the eighth grade. And so, one of the things that might be good across the board is to help children stay in school so that they can become more educated and therefore be safer and things like this. One of the points that I believe touched on or will touch on is local representatives, people on the ground, especially in rural and kind of slum areas, that can help if they don't have access to smartphones and all the literature that is out there, to help foster greater awareness and safety implementation so that they can have that information again and know what to do with it.
Great.
That's what about that.
Great. So I will be just doing the finishing touches on this by telling you about the monitoring and evaluation program we're thinking of. First of all, we should be continually tracking the progress of our performance by ensuring that we look at the spread of the burden of the disease over different time periods. We should do sound and thorough monitoring and evaluation strategies, allow decision makers to assess the effectiveness of various strategies on the dengue transmission. And these are some of the methods we're looking at implementing. The disease surveillance, where we track the number of infected persons by cases, either via doctor's visit or hospital visits. We can detect outbreaks based on serological evidence by doing laboratory tests, and if that is not available, as Garrett has said, that possibly there must be funding has to be put in place. Then we can also look at the number of severe dengue cases and deaths. In the epidemiological surveillance part of things, we can look at the clinical cases of dengue and severe dengue, and look at the laboratory tests will tell us which cases are real dengue and which cases are showing the circulatory types that are causing the problem. In vector control, we can track the mosquito population, and we can look at control measures to detect whether they're more dense or less dense in those areas that we were eradicating. We can also look at the larva surveys to see what percentage of the households are infested with larvae. And also we can look at adult surveys to find out how many persons have been using the techniques that were preventative. And also the last one we could look at is monitoring the behavioral impact in observing whether the behaviors aimed to reduce dengue transmission were adopted and sustained by the community. So there should be a communication called a communication for behavior impact, COMBI. It's a methodical process which blends a variety of communication interventions to engage individuals, families, and others to adopt health behaviors and maintain those behaviors. So we'll be focusing on implementation and maintenance of the behaviors and monitoring the communities. And COMBI needs to be monitored by appropriate behavior indicators apart from those that were mentioned. So there we are. We have wrapped up the different things that we were thinking of, and we're hoping that it can be put into any community and used as an example of getting a pilot project going in India.
Thank you.
Thank you.